Good afternoon. Welcome to the 6th International Webinar of 2021 organized by Vets and Clinics by Advance. My name is Alba Martos. I'm the International Vet Manager of Affinity Petcare. And today my guests are Lluís Vilaseca and Victor Fragua. So I'm really happy to meet them in person after almost 2 years without this option. They are researchers and they are the responsible for the technical communication in our R&D department in Affinity. And also Lluís studied a master's degree in clinical nutrition in Iowa State, and Victor is a PhD from the University of Barcelona. So good afternoon, Lluís and Victor.
Hello. Good afternoon, Alba.
Thank you for being here with us. So well, this webinar will be quite different compared with the other ones, because what we have done is we have sent a survey to more than 5,000 vets. And this webinar is the result of the frequent asked questions from these vets. So I think that it will be a special webinar this time. Before starting, I would like to remind you that you can download the presentation when we finish, clicking on the link you can see below on the YouTube description. And well, I think that's all from my side. I will not delay any longer, and we will start this webinar. In this case, we will start with Victor, with the first question we have received from the vets. Well, we have been receiving a lot of questions, but we have several questions about the homemade diets. So I would like to ask you your opinion, if there is scientific evidence to use these diets, which advantages and disadvantages they have, anything you can consider useful for us.
Thank you very much, Alban. Thank you again for the presentation. So we are going to begin, try to solve all these doubts that you have put on the table. And first of all, I would like to start with the definition. What do we understand by homemade diets? These homemade diets are recipes based on ingredients that are usually fit for human consumption and are prepared at home by the pet parent. So what these homemade diets should be and should not include, they must be, the most important thing, they must be complete and balanced. This means that they must provide all the nutrients and energy that a dog or a cat needs for their proper development. And we should not think of these diets are based on table scraps, leftovers, or recipes that could lack a correct nutritional balance. So what are the indications for these homemade diets? I think that as a general rule, the homemade diet should be used when there is no equivalent commercial option of food available. And therefore, they can be used as elimination diets. This will be the indication number 1, so to help diagnose the adverse food reactions. In this case, it's important to understand that the homemade diet is not essential, that this homemade diet to be complete and balanced meal, because finally, we are going to use this homemade diet for around 6 to 8 weeks. One of the greatest benefits of homemade diets that I put as indication number 2 is the fact that this homemade diet can be tailored to the individual needs of each patient. And this is important, or this could be useful, because, for example, when we do not have commercial options available for cats and dogs in the dry market. For example, a patient that could have pancreatitis or an adverse food reaction and plus a chronic kidney disease, or patients who require, for example, very, very low-fat diets. And finally, homemade diets can be an option as well for cats and dogs who don't like commercial options, or pet parents that would like to cook for their dogs and cats. These will be the 3 main indications that we can find in the literature, in the scientific literature. As a vets, I think that we have the responsibility to ensure that these homemade diets are formulated by nutrition experts, either from the European or the American college. In this presentation, I put some web pages from both colleges, the European and the American, where you can find directories listing nutritionists and their contact details. And you can contact them if you need to formulate a homemade diet, prepare a homemade diet for your dog or your cat. It's very important to avoid the temptation to use generic recipes that you can find in blogs, in websites, or even in veterinary practice books, general veterinary practice books, because some can involve a risk of deficiencies in certain nutrients. And I would like to put some examples on this, and let's take a closer look at this part. A group from the University of Davis in California analyzed different generic recipes that you can find in blogs, websites, as I mentioned, in general veterinary books. And for example, the article on the left in Dogs, published in 2013, analyzed different dog recipes that they found in internet, and they found that 167 out of, more or less, out of 200 recipes presented multiple deficiencies in essential nutrients. This is important because we could have problems with these dogs and cats using this kind of recipes and problems with the pet parents. And in 2019, the group of Davis, again, they published an article in Cats, and they showed that 85% of the recipes analyzed, in this case, were lacking multiple essential nutrients. So this is important to take into account. So I would like to pass along now to the different disadvantages that we can find in the scientific literature for this. Firstly, the databases is a limited factor, because finally we are using databases of ingredients fit for human consumption. So the quality of the resulting formula, of the resulting recipe, will depend on the reliability, the specificity, and the accuracy of these databases of human ingredient. And this is very important to take into account, and for me, it's the disadvantage number one that we have. And in addition to these possible databases incoherencies, we have the disadvantage number two, the adherence. And what do we mean by the adherence? So the adherence refers to how closely the pet parent is still following the recipe that is formulated by the nutrition expert after some time starting their pet's new diet. So to understand better this, an article in 2016 by Dr. Freeman Group at the University of Tufts in Boston found that after few months of giving this recipe, some pet parents were doing different changes to the recipe, adjusting some of the amounts, replacing some ingredients by others, and even omitting or adding new ingredients to the formula. And this is very, very important, because finally it can lead to deficiencies in different essential nutrients. In fact, they found that approximately 86.6% of the pet parents were doing this kind of changes in the recipe, adding ingredients, omitting, replacing some ingredients by others, or even adjusting some of the amounts of the ingredients. And the third disadvantage, as you may thought, is the preparation time. Obviously, if the pet parent has to cook for their pet, they will need to spend longer preparing the recipe, the dog and cat's meals. And these homemade diets require an investment of time, and you have to preview your pet parent on this. This food needs to be cooked every day on a regular basis. Although this ration can be obviously frozen, there are supplements or oils and so on that has to be added to each meal. So this is very important to take into account. And last but not least, we have the cost. No? A 2020 study in Brazil showed that homemade diets compared to dry commercial options were more expensive. So they established that approximately these homemade diets cost 3 to 4 times more than a super premium commercial product, and between 5 to 7 times more than a premium product, compared always with the dry commercial options. So a little bit, this will be the disadvantage. For me, the 1 and 2 will be the most important ones, but we have to take into account everything. I think that, Alba, more or less, we have had a good look at all of this scientific literature, so I don't know if you have any questions or some requests.
Thanks, Victor. I think that it's quite complete. So I think that we can move to the next question. Another issue that we have been receiving a lot, it's about barf diets or raw food. So I don't know if you can share with us your experience, your opinion, what we can do with that.
So yes, Alba, I think that This is the most common question that we have by vets in the last, I will say, 5-6 years, because they have really a lot of doubts about these barf diets, these raw diets, and the advantages and disadvantages that we can find with this kind of diet. So first of all, I would like to start again with the definition. So these raw diets are recipes that are based on uncooked or raw ingredients for dogs and cats. But what does this acronym stand for? What does BARF stand for? When raw diets first came out, BARF, that's B-A-R-F, was an acronym for bones and raw food, as these early raw diets included bones in their formulation. With time, this acronym has evolved into biologically appropriate raw food. And nowadays, more or less in the dog and cat food market, it's currently used as a synonym for raw diets, regardless of whether they contain or not bones in their formulation. But I would like for you to understand as well what are pet parents' reasons for giving raw diets to their cats and dogs. Firstly, the first motivation, I will say, is that they are similar to the diets of cats and dogs, wild ancestors. And secondly, because it's believed that certain nutrients present in animal origin ingredients, due to the fact that they are not processed, are more readily digested, are more readily to be used, are more bioavailable. And let's see what's on this, if this is true or not, the benefits finally and risk of these raw diets, and what's the science telling about this. So first of all, in terms of benefits, some articles show that cats and dogs find raw meat diets more digestible, while other papers in dogs mostly report they are more palatable, they have more palatability. So this will be the benefit, and as for risk, the main threat from these raw diets comes from the high microbiological risk. Finally, these foods have a high microbial load, and this significant high microbiological risk, can lead to zoonosis in the case of Salmonella or Campylobacter. Moreover, Dr. Kinsel's group in Munich have reported as well some nutritional imbalances in this raw meat diet. In fact, this group in Munich has analyzed several raw meat diets that they found in the German market, and they've realized about the fact that 60% of these raw diets were deficient in some essential nutrients. So this is important to take into account as well. And as you may think, if barf diets or raw meat diets contain whole bones in their formulation, we have to take into account the associated risk to these bones incorporation. So broken teeth, enteritis, gastritis, or even gastrointestinal perforation. It's very important to minimize, to reduce the risk of these homemade diets by using reliable pet food companies and reliable pet food products. This is very important. And always following the WASABA recommendations on selecting pet food. So more or less, I think that we have answered what we have about this type of diets, at least.
Yes, I think that we have a global overview about these diets. So, well, you can relax now, Victor. We can move now with Lluís. Lluís, the third question we have, it's about grain-free diets or diets without cereals, that it seems that they are being used more and more. So, which is your opinion? Is there any scientific evidence on the use of this diet, or it's more a trend that we are suffering?
Well, the grain-free diets are diets that have become popular over the last, I would say, 10 to 15 years. There are different arguments or beliefs that contributed to the rise of these grain-free diets. One of the beliefs is that grain-free diets are more natural, that they resemble more the ancestral diets. Because dogs and cats are of carnivore origin, they were not used to eating cereals. No? Their wild ancestors, like the wolf or the wild African cat, they didn't had access to these cereals in their wild environment. No? And the reality is that dogs and cats are not the wolf or the wild cat anymore. They have evolved and they have diverged from their ancestors. Since they were domesticated 14,000 years ago in the case of dogs, or 3,000 years ago in the case of cats, they have had access to the human foods and they had access to cereal. No? And their metabolism has adapted to these new foods, and they are capable of digesting them and using them. The second belief is that carbohydrates are bad for health. And this belief is influenced by human dietary trends back in the early 2000s of the low-carb diets, like, for example, the Atkins diet. No? This type of diets, there was a reduction of carbohydrates, and these carbohydrates were replaced by proteins and fats. No? The truth is that grain-free diets for dogs and cats, they do not contain cereals, but they do contain carbohydrates. The cereals are replaced by other carbohydrate sources like potato, tapioca, pea starch, sweet potato, for example. And if these carbohydrates are properly cooked, they can be used, and they are available to dogs and cats. They can digest them almost 99% of the carbohydrates. The last belief is that the carbohydrates have a low nutritional value, that they are added in the recipes as a filler. No? This again is not true, because besides the energy content that carbohydrates supply, when these cereals are used, or these carbohydrates when added from cereals, no? These cereals, when used as whole cereals or whole grains or whole meal cereals, they retain most of the nutrients that are lost during the refining process. These nutrients, besides the energy, are proteins, essential amino acids like arginine or lysine. They also contain fiber that is very useful for the digestive process or to enrich the microbiota. They also supply essential fatty acids or, for example, B vitamins.
Thanks, Luis. Related with that, we have another question, and it's that if the cereals can provoke allergies or even gluten intolerance, or what's your opinion about that?
Okay, so these are two questions, no? Allergy and gluten intolerance. So we can separate the two questions. First, let's see the allergies, no? So let's start to define what is food allergy. No? Food allergy is a type of adverse food reaction where the immune system is involved. Okay? In an allergy, in a food allergy, the protein in the food triggers hypersensitivity reaction that usually can can be seen with cutaneous signs, no? And often it's called cutaneous adverse food reaction. Food allergy can occur suddenly after many months or even years of consuming the inciting protein. So this is what is the food allergy. Then what is the prevalence of food allergies? Is something common or not? No? The prevalence of food allergies is not unknown or is not known exactly, okay? Because the difficulty of reliable diagnosis, and also because data in published literature is very diverse. No? The most reliable diagnosis for food allergy today is still that of lengthy studies with elimination and challenge diets. With the different studies that we have available, an estimation of prevalence of food allergies is about 8% of the total population. This is in dogs. In cats, the data is even more scarce. There was a study from Allergy that they did a systematic literature review of many studies that presented data on cutaneous adverse food reactions. They took studies since 1985 to the date they published the study, and they revised a total of 710 studies. And from these 710 studies, they selected 22 studies in dogs and 9 studies in cats that were reporting prevalence data. And they saw that in the case of dogs, the prevalence of cutaneous adverse food reactions was low. Okay, so for the dogs presenting at the veterinary with any type of disease, they saw that the prevalence of cutaneous adverse food reaction was from 1 to 2%. For those dogs presented at the vet with skin symptoms, the prevalence was slightly higher, so it was about 6%. These are median values. For those dogs presented with pruritus, the prevalence was 18, and then those presenting with some type of allergic skin disease, the prevalence was about 20%, and those dogs presented at the vet with skin lesions that could make you think that could be a case of canine atopic dermatitis, the prevalence, the median prevalence reached 29%. In the case of cats, the numbers are similar, and the cats presented at the practice with any disease, the prevalence of food allergy was 1% or less. Those with skin symptoms was about 5%. The cats that presented with pruritus was 17%, and those with skin lesions that could be or could indicate atopic dermatitis, the prevalence was 10%. So it does not seem is the prevalence in the general population, the prevalence of food allergy is very high. So now, this is food allergy. So what is the prevalence of cereals causing food allergy? Here again, there are several studies. One of them is a study from Berlinden in 2006, where they took also a historic of published papers where different ingredients were identified with food allergies. No? And they saw that the wheat was the third ingredient that caused allergy more frequently, after beef protein or dairy proteins, no? And then followed by, for example, egg protein, which is also a very common allergen. After the egg protein, there was a group that you can see in the chart that is diverse. This is a group of foods that there was a report of food allergy, and in these foods there was corn and rice included, but it was not clear which was the ingredient triggering the food allergy. So in dogs, wheat seems to have a quite high prevalence causing the food allergy, but not corn or rice. In the case of cats, the situation is different. In cats, in this study, they saw that barley and wheat are in the sixth position of ingredients causing food allergy. There is another study from Rothbusch in 2013. Also, they took several studies of foods causing allergies, and they identified similar results to Berlinden. No? The wheat was number 4 protein triggering the food allergy, and then corn and rice are really low in the list. In cats, is slightly different. In cats, the corn is the number 5 ingredient that could cause food allergy. But they are quite far. Dogs, the ingredient in dogs and cats are quite far from the beef, for example, beef protein or dairy protein or chicken protein. And finally, Miller in 2016 also published similar results to Berlinden and to Rothbusch. And you can see that wheat is number 4 in dogs. Corn has a similar effect in dogs and cats, and rice probably is the cereal with the lowest prevalence of causing food allergy. So maybe as a summary, cereals are not themselves are not causing allergy. It's the protein contained in the cereal that they can cause allergy like any other protein. But taking into account the prevalence of food allergy, which is low, and the fact that cereals are not the most reactive proteins in terms of triggering allergic reaction, we could say that the risk of cereals to cause food allergy is low. But if you have a confirmed diagnosis of food allergy by an elimination and challenge diet, that a cereal is causing the food allergy, then it makes sense to recommend a grain-free diet.
And Luis, what about the gluten intolerance? Can you share with us your experience?
Yes, this was the second question. The gluten, the cereals do not cause gluten intolerance or celiac disease in dogs or cats. This is a belief that comes also from the human food. No? In humans, cereals are associated with the gluten hypersensitivity of the celiac disease, and that's why pet owners are concerned, or they prefer maybe diets gluten-free. No? The gluten intolerance is not like food allergy. The gluten intolerance is a food intolerance, no? As the name indicates. Is a type of adverse food reaction where the immune system is not involved. Okay, is an idiosyncratic reaction that has gastrointestinal signs. In the case of food allergy, we were seeing mainly cutaneous signs. In the case of gluten intolerance in humans, has these gastrointestinal signs. The gluten is the protein contained in some cereals like wheat, barley, oats, rye, and other cereals like, I don't know, maybe some ancient cereals also, but is not present in corn or rice. Okay, and this is important to have in mind. Gluten-free diet, therefore, doesn't necessarily mean that do not contain cereals, because you can have a diet with corn or rice that will not have gluten. But a grain-free diet, for sure, will not contain gluten. We have said that gluten intolerance is not present in dogs and cats, but this is not strictly true, because there have been some reports of gluten intolerance in dogs. In cats is not known, but in dogs there are the gluten sensitive enteropathy in the Irish setter. That is a hereditary trait that affect the Irish setters, and they have gastrointestinal signs, especially in young animals, that when fed gluten containing diets, they have this intermittent chronic diarrhea, poor weight gain, or even weight loss, etc. And then we have another case of what is called the Canine Epileptoid Cramping syndrome. That is an abnormal, uncontrolled movements in the gastrointestinal tract, with intermittent vomiting, diarrhea, peristaltic sounds, and abdominal cramps. It's not clear if it's the gluten causing this, but pet owners and also breeders have reported that when feeding grain-free diets, these symptoms were reduced significantly. No? So it could be that gluten is causing this, but it's not clear.
Thanks, Luis. So now to finish the topic with the cereals and just to make more practical all this information, can you share with us the 3 decisions that we can follow when we suspect on a food allergy in a dog or cat?
Okay. Well, I will focus mainly in dog. Our decision 3 is that our recommendation is when a dog is presented at the practice with a chronic pruritus, the first thing that we need to do, we need to discard any external cause like parasites or skin infections, etc. No? Once we have discarded these problems, then we can see that we are in front of a dermatitis. So the first thing we need to do is to medicate the dog, so the dog can stop scratching and causing lesions to himself. With the medication, we recommend to directly feed atopic diet. No? This why? Because most of the dogs that present to the practice with a type of with dermatitis, approximately 60% of them, the cause will be atopic dermatitis. And usually, if you start feeding with atopic, the problem will be solved. If the problem is not solved with the atopic diet, then we can suspect that we have a food allergy. And then we could switch to hypoallergenic type of diet with hydrolyzed protein. If you suspect that is not atopy because you have a non-seasonal pruritus, you can go directly to a hypoallergenic diet and to perform the exclusion and challenge protocol to define what is the food allergen causing the allergy. So when you feed, if you choose to feed the hypoallergenic diet, if the problem is solved, you are in front of one food allergy, and then you can stay with a hypoallergenic type of diet. If the problem is not solved, then there is no sense to maintain the dog with a hypoallergenic type of diet. In this case, we recommend to switch to atopic, because this it means that we are in front of one of the low percentages of dogs that is not clear if they are atopic or if they are or if they have a food allergy.
Thanks, Luis.
Okay.
Let's move now again to Victor. Victor, I have another question about one topic that it's more and more common, both in humans and also in pets, that it's about vegetarian or vegan diets. So which options we have with this kind of diets with our dogs and cats?
Thank you very much again, Alba, for the question. And yes, I agree with you that this is actually a very common question among the different pet parents that goes at the clinics and send questions at our consumer care, for example. This is a point that generates, I will say, a lot of controversy. And I don't know now if today we will reach a definitive recommendation that will please everyone, but let's see what is in the scientific literature, no, and what most veterinary nutritionists recommend to this kind of diets or in relation to this kind of diets. And once again, as we did for the homemade diets, as we did for the barf diets, let's start with the definition of this vegetarian world. So on the one hand, we have ovo-lacto-vegetarian diets. In this case, are commonly called as vegetarian. And in this case, we include eggs, we include dairy, and as well as ingredients of vegetable origin. And on the other hand, we have vegan diets, also called as strict vegetarian, and this kind of diets excludes any ingredient of animal origin. So no eggs, no dairy in this case. So, and again, as we did for the homemade diets and as we did for the BAT diets, the barf diet, sorry, what are the pet parents' motivations for giving vegetarian or vegan diets to their cats and dogs? In this case, a study in 2019 involving universities in Canada and New Zealand analyzed this profile of the pet parent, vegan pet parent, and they realized the reasons that are behind this practice for feeding dogs and cats. They conclude that in most cases that these pet parents wanted to give their animals the same diet that they have chosen to follow for them, for themselves, and these are pet parents that are very, very concerned about animal welfare, about protecting the environment, leading a healthier diet, a healthier lifestyle. But they are, however, they did have doubts as to whether these diets provide an adequate nutrition for their dogs and cats. So we'll try to shed a bit more light on this last point, and let's see if are these vegetarian or vegan diets adequate nutritionally for dogs and cats. So in the case of dogs, I will say it's a little bit easier. Why? Because dogs are omnivores, or depending on the literature source, facultative carnivores, and can therefore adapt to a diet with these characteristics as long as, obviously, it's properly formulated and balanced. They can adapt to a diet based on ingredients of plant origin. And this is stated by the FIDIAF as well in 2017. But when formulating a diet for dogs using this plant-based ingredient, it's very important to pay particular attention to the concentration of several essential nutrients that are more concentrated in animal origin ingredients. And if needed, it will be interesting to add these nutrients synthetically. This could be the case, for example, for some sulfur-containing amino acids such as methionine, or in some cases even taurine. Even if it's not essential for dogs, it will be interesting to add in this kind of diet sometimes. Vitamins, as for example the vitamin B12, and minerals, as for example the calcium. This is the nutrients that are commonly most deficient in this kind of diets, and that we have to pay particular attention, as I mentioned. And again, following always the WhatsApp recommendation on selecting this kind of pet foods. Okay. Cats is a little bit more complicated. However, but as you may know, cats are strict carnivores. So if you remove the ingredients of animal origin from the diet of an obligate carnivore, then we have more chances of suffering nutritional deficiency, and these chances increase significantly. Many essential nutrients are lacking in a plant-based diet. So we have to take more consideration when analyze these vegan diets for cats. We have to be aware that it's more problematic sometimes. In fact, we are going to analyze some studies analyzing these vegan and vegetarian foods marketed in the US and Brazil, above all. And these studies have reported the following nutritional deficiencies. So let's go step by step and taking a look to each one of the nutrients. So on the one hand, as you may know, protein and amino acids, because cats have high requirements for these two, for protein and for amino acids, as the body of the cat catabolizes them rapidly via the urea cycle. So in the case of cats, if protein resources are low, these cats cannot reduce the rate of protein catabolism. And this makes cats especially sensitive to protein deficiency, one, and to the lack of certain essential amino acids that are very important in this urea cycle, as for example the arginine. And this arginine is highly concentrated in ingredients of animal origin, so this is a point to take into account. Two, as we mentioned, for dogs, it's important to ensure the provision of sulfur-containing amino acids, such as methionine, like in dogs, or taurine. Unlike dogs, cats cannot synthesize taurine from methionine and cysteine. So taurine is essential for cats. This taurine is highly concentrated, again, in animal origin ingredients, and sometimes even in diets for cats where where we put animal ingredients, we found that sometimes we have to add this taurine as a supplementation. So it's absolutely mandatory to include this taurine in an hypothetic vegetarian or vegan diet for cats. Okay. So on the other hand, we have the arachidonic acid. It's an essential omega-6 fatty acid for cats, not for dogs, and is mostly found in animal sources. There are some algae concentrated in this acid arachidonic, but above all is in animal sources. Then cats, like dogs or humans who want to follow a vegan diet, we need a supplementation of vitamin B12. But furthermore, moreover, cats, unlike dogs, cannot synthesize vitamin A from beta-carotenes. These beta-carotenes are the vitamin A precursors of plant origin, and cats cannot assimilate and use the vitamin D2, the ergocalciferol, that is found mostly in plant ingredients. To finish, it's important, as in the case of dogs, these studies analyzing vegan diets have found some deficiencies in calcium, in some minerals such as calcium, phosphorus, iron. So it's important to take into account this as well. And as a conclusion, I will say that in cats, if we eliminate the animal ingredients from her diet, then it becomes quite hard to formulate the recipe. So the recommendation of the specialist, of the nutrition specialist in this case, is not feeding the cats with these vegan diets, or be aware about all these problematics that we can find. I don't know if more or less we have answered the question and we have shed a bit of light.
Yes,
but
I think so. I think that it's a complete answer about the vegan and vegetarian diets. Thanks, Victor. So, well, we are at the end of this webinar. Thank you very much for your time. And thanks all the attendees to join this event. If you like the presentation, you can give us a like, and also you can subscribe to our YouTube channel just to be aware of all our news. So, well, that's all from our side. We will come back in 2 weeks with a webinar about canine epilepsy given by Elsa Beltran from the Royal College. And that's all. Have a nice week and see you soon. Thanks.